Scoliosis is a sideways curvature of the spine that deviates from a normal patient's regular alignment. A normal spine has a slight gentle backwards curvature in the lower back, forward curvature in the thoracic spine, and gentle backwards curvature in the cervical spine. When we look at the spine from the front, it's nice and straight. However, with scoliosis, there's a sideways curvature causing an imbalance. Families and patients can do their own evaluation for scoliosis without seeing a doctor initially. Just by looking at their overall balance, seeing if they're able to stand upright, when they bend forward, see if there's any unevenness of the ribs, their shoulders, or even their hips. Other things that can be indicative of scoliosis is when walking, there may be a limp or an imbalance in the length of the legs. If you're concerned for any of these symptoms, you can ask your physician or neurosurgeon, and we can obtain additional imaging, typically an x-ray, to evaluate the spine and see if there is an actual scoliosis or spinal deformity. Fortunately, most scoliosis and spinal deformities do not require treatments at all. Usually when they're found, the physician can obtain an x-ray to see the degree of the scoliosis or spinal deformity or kyphosis, and then we can evaluate depending on the severity if anything needs to be done. Options include bracing. If patients are young and there's still growth potential, then we put young patients in a brace, so as they grow, the scoliosis corrects itself. For adult patients who have already passed their growing years, they have degenerative scoliosis. That can be managed more with pain medications, physical therapy, pain management including injections. If surgery is required, whether due to progression of the scoliosis or spinal deformity or non-responsiveness or failure of conservative management, then we typically try to utilize minimally invasive techniques so that we can realign the spine, maintain alignment of the spine without causing collateral damage to the surrounding spinal structures. In most cases, scoliosis does not progress. In patients who have scoliosis at a younger age, once they reach skeletal maturity, the scoliosis does not progress. However, other forms of scoliosis, including degenerative scoliosis or scoliosis due to trauma or previous spine surgeries, or significant scoliosis that has not been treated as an adolescent that now progresses into adulthood, can progress and get worse. Typically, these patients present with weakness and neurological deficits, including pain, numbness, and tingling. In patients who are older and scoliosis is due to degenerative changes, typically scoliosis does progress, but it does not progress rapidly. It's usually a slow progress that happens as the patient ages, or if they have significant risk factors that increase progression. These risk factors can include age, diabetes, or smoking, poor bone quality, including osteoporosis. If you feel that you have scoliosis or a spinal deformity, and you feel that you have symptoms including weakness, pain, numbness, and tingling that may be going into your arms or your legs, or you notice changes in your posture, either leaning to the side or forward, please reach out to Advanced Neurosurgery Associates at Northside Hospital.